Hey guys, Dr. Derry here, owner of Revision Health Services. And so with my practice, I go to people's homes and I help them decide what the next best step is for them. And so in this particular patient, we've been doing some physical therapy, not really hitting the outcomes that we would like. That happens sometimes, guys, right? And so we do our best, but sometimes that happens. So we start bringing other people in. In this particular case, it was a neurosurgeon. So helping us decide what the best next step is for her. And in regards to her walking ability and the back and leg pain that she was experiencing. And so I want to tell you about that experience because I went along with her and her husband to the spine surgeon appointment. And I want to tell you how it went and how I wish things would have gone a little bit differently. So hang with me if you want to find out, and I'll see you in about 2.5 seconds. All right, guys. So a part of my care is to make sure people are taken care of, right? Start to finish. And so as a physical therapist, I'm educated in not only the conservative interventions, but the surgical as well, especially becoming board certified. And so I want to make sure that people are getting the care that they need. And I want to learn things along the way as well. I'm not saying I know everything, but when I'm treating a patient, and the outcomes are not going as well as we would like, we start getting other people involved. And in this case, it was a neurosurgeon, someone that specializes in surgical interventions for the spine to help relieve leg pain, radicular pain, or nerve pain, as well as back pain. It could be one of those things or a combination of those things. And we usually don't get these people involved unless the trajectory of their symptoms and the outcomes are not really going as what we would predict or would like. And in this case, in this patient, it was like that. And so she was continuing to have some leg pain and back pain that was preventing her from walking and going and doing the things that she wants to do around the house. And especially was really important to her is getting up and dancing again and be able to walk at Disney. And so living here in Florida, that's a very important thing that we want to be able to do. And I wanted to help her get there. And so we found a recommended surgeon in the area and kind of decided to go hear what we had to say. And so we went to the appointment together. And so I went with her and her husband just to help them kind of receive some of that information, make sure they get their questions asked, and to help provide the surgeon with a snapshot of her body, because I've spent hours and hours with her body and how it presents, and just giving everybody a more well-rounded picture of what's going on. And so that's exactly what happened. And so I want to give you a little recap of about 3 things that I wish would have gone a little bit differently with that appointment. And so one of those being that there was a little bit higher level of empathy from the provider. And so empathy is that ability to relate with someone's condition or what's going on in their life. It's not necessarily feel bad for them, but help relate to their situation and understand where they're at that point in time, meet them where they're at, and just be able to put yourself in their shoes. And so he did a quick exam, which was good. I really, really appreciated it as a physical exam. Some surgeons don't even do that. Looked at her images, talked to her, found out the background, and then recommended his best intervention for that moment. And his recommendation, the very first thing that he brought up was a fusion. And so a fusion to your lumbar spine is kind of something that people want to stay away from. I've treated them, I've rehabbed them, I've seen what their outcomes look like now, but also in their future. And I would agree. I would say that you probably want to stay away from that from a care aspect as long as you can, unless you have some instability or gross neurological change, in which the neurosurgeon in this particular case did not say that I was 100% necessary. And then he started rattling off a bunch of other treatments that she could do, ranging from more injections or burning of the nerves or other testing to help figure out if the disc was causing her pain or the pinched nerve was causing her pain or just age-related changes. And so, what I did appreciate was that he was honest where he was at and saying that maybe this is what's causing your pain. What I didn't appreciate is that he started saying all of these terms and recommendations without a thorough explanation. And at this point in time, the client was visibly upset. And it was a lot to take in a short amount of time. And so I believe that appointment would have went a little bit better if there was a little bit more of a streamlined process, and that his recommendation was followed with some high level of education that the patient can understand. Be it again, that happens all the time. I'm sure we've all been there. And that's kind of why I like to go to the appointment with him, so I can help decipher some of that information. And so that was the first thing I wish would have changed. Maybe just a higher level of empathy. That is something as a provider and many other providers that we try to focus on, and just putting ourselves in your shoes, and that we may not be experiencing what you're experiencing, but the limitations that you're having and the discomfort you're having, if we can have a better idea of that, that can help us make help us guide our decisions a little bit more and a little bit specific towards you. And so I wish there was some level of empathy there that was hit. And so the second thing that I wish would have gone a little bit better is that as a provider, as a neurosurgeon, MD, they're very much in the pathoanatomical model. And so the pathoanatomical model means we really take a look at the human body and what is abnormal versus normal, and we try to fix the abnormal. The problem with that is that with age and over time, lots of things become abnormal. I've spoke about this in other blogs and videos, but you can have all of these changes in your back, ranging from degeneration to facet arthropathy. You can have disc bulges, even herniations, and all these people that don't have symptoms and have symptoms. It's really gray. And what I really appreciated that the surgeon was very open with that. He's like, if I were to do MRIs and all of these people, they would probably show similar things, but you have pain and they don't. And so from a pathoanatomical model, if I go in and I put screws and rods in the segments that I think is causing your pain, it should help with your back and leg pain. And I really appreciate he framed it as not a magic fix, because it's not, right? And so in the pathoanatomical model, which we have been in for many years, we try to see X, fix X, and it should help your symptoms. But we know people who have done really well after surgeries and people who haven't done really well. So that model doesn't fit. It just doesn't work anymore. Pain is much more complex than that. And your body is a system, it's a whole. And so we got to look at you as a whole. And so I think that was really missed. Options that were provided for her other than the fusion included injections and stuff that I mentioned earlier, but he never once mentioned like maybe, fixing your diet and nutrition, looking into that as well. That's highly tied to pain. Maybe looking at different weight management strategies, because of just physics and joint reaction forces, you're going to have increased pressure in those joints. And so I'm not saying one is more important than the other. And I'm also not saying that we should only focus on one, right? It should be a holistic picture. And so I wish you would have had some other non-pathoanatomical pathways for her to pursue instead of the fusion, because she was visibly upset that that was an option. And he also said it wasn't a necessity in that moment. And so it's not high required because of medical compromise, or her body wasn't just in a position that she absolutely needed in that moment. Now, she is able to sit pain-free and do some other things pain-free, but then has pain with walking. And so there is an intervention that's needed, but that probably wasn't the first one that should have been brought on the table. And so stuck in that pathoanatomical model, that is something that we're all trying to get better at, but looking at this body as a whole. So I wish you would have done a little bit more education on that, or at least given her an option. And that would have just been really nice for her to get that glimmer of hope. And so when I look at the whole situation and maybe what I've done differently, it's not his fault. And so I'm not passing fault to anybody. It's a system that we work in, right? And so when you're in a volume-based system and that you get paid per visits and not necessarily based on the outcome from the patient, then you're going to focus on doing more patients at a time, because more patients, more diagnostic codes, and more codes submitted and claims submitted, then you get more reimbursement back. It's all based on volume. Now, you may lose that potential customer in the future if they don't get the outcome that they want, but there's a lot of people in pain and a huge shortage in providers. And so I don't think that's going to be an issue. But I think once we move into a system where it's more based on value than volume, then I think you're going to notice a difference in that level of care and options that you're going to be given. So was it his fault? No. Was I really happy that I was there? Absolutely. And so to recap, I wish there was a higher level of empathy. I wish there was a little bit less reliance on the pathoanatomical model and the medical model. We know there's other ways to get better other than just putting someone under the knife. And then, is it his fault? Is it anybody's fault? It's just the system that we have to work in right now. And so in conclusion, I'm really glad that I was there with her and her husband, because afterwards we were able to just put out there all the treatment options, discuss on what her preference was, discuss maybe what the best evidence shows, or people like herself have had type of outcome that they're looking for with an intervention, and then give her some time to just kind of go over it and surround herself with her husband and just talk through it together. Because during the visit, she had asked him if this was a serious surgery, and he goes, "Serious for me? Well, not really. I do this all the time, but it is rods and screws in your back, and then the chances of you needing another fusion are higher in the future. And so it is very serious. And when you're talking about doing something that you can never return from, you need to take it very seriously. And so we were able to talk through all of those options together for her, and then kind of figure out the best next step. And so she walked out of that appointment a little overwhelmed, but as soon as we got to discuss it a little bit more, she felt better. And so I love going on these appointments with patients because we were able to do that. And I was able to see kind of that interaction, and they were able to see my involvement as well, because the surgeon asked me good questions about what I've seen in her body, and being able to tie in what we've all seen together to provide the best treatment for her. But it was leaning a little bit more towards the pathoanatomical, and that he weighed more on maybe the images and other testing, that maybe he should have just taken a bigger, a more holistic view of that patient. And so it is what it is. It's kind of what happened. I've seen it all the time, but in the end, you're just surrounding yourself with people, putting your team together, and just going to take bits and pieces of information from everybody and figure out the best next step for her. And so I was glad I was there. I'm really glad that the surgeon was open to me being there. There's a lot of good things about the appointment, just a few things to change. And I would say that those changes are not limited to just him and his appointment with the patient, but also other providers and other, including myself, of things that we need to improve on all the time. And so being a fly on the wall during that session, I was able to see some of that. And so I'm very thankful for that patient allowing me to go, thankful for the surgeon and that hospital-based system to allow me to join. But we're working as a team to get the patient better. And so I'll absolutely keep doing that. If you guys have any questions or comments, please feel free to post in here as well, into the comments section. But don't forget to subscribe, right? I'm doing this stuff all the time, and just kind of give you a snapshot of maybe what a certain neurosurgeon appointment could go like. So until next time, just stay healthy, keep moving, and take care of yourself.